Hi, guys. Welcome back to another episode of Personal Trainers Who Care for our third season. So, for our first episode, we're going to kick it off with Liam Graham-Morton. We practiced that. He's an osteopath from Glebe Osteopathy and Wellness. And we actually met because we did a little info sesh, I guess, at the Glebe. So, a few of you Glebites probably saw that. But yeah, we sort of connected after that, and I decided to bring him onto the podcast. So I'm going to hand it off to him to give a little bit of an intro, and then we're going to get right into it. Hi.
Hi. Yeah, it's nice to be here.
Yeah, I'm glad.
Yeah. So I'm Liam. I've been practicing for almost 10 years as a manual osteopath, and I got into the profession as a teenager. I actually hurt myself snowboarding. I messed up my shoulder pretty badly, and then through seeking treatments, I found osteopathy. I went to massage, chiropractor, did all the different things I had to do, and then osteopathy was what really helped me and made me enter kind of into a pain-free lifestyle. So I thought, as I was graduating high school, why not jump into that?
Really?
Yeah.
Okay, I actually didn't know that about you. That's interesting.
Yeah.
I'm guessing you were going through a bunch of other practitioners before, and then you said you finally found your osteo.
Yeah, so I think I focused more on massage as kind of an outlet, but I did try physio and chiro, and then I think my mom actually recommended to go see her osteopath, and it was like within 4 sessions I was pain free, and pain that I didn't even know I had was gone too. Like I went for a shoulder issue and then left. Realizing I have a lot of back pain, and she got rid of it all. So
No
pretty
way.
cool, pretty cool.
It's so cool. And it's funny because we've talked about this before, but how much of a bad rap osteo has, and it's sort of like in woo-woo territory, and people are like,
Yeah.
oh, that's pseudoscience, and it can't do anything for you, and there's no like verifiable information. And I think that's kind of what makes it powerful in a way, and that people don't really know what to expect from it. They don't have a preconceived notion of what's going to happen to them, and then they sort of get to explore themselves from an individual basis. Why don't you tell me a little bit more about what osteopathy is, just because we really need to demystify that. So many people, even prepping for this podcast, were like asking me like, "Oh, who are you having on?" I'm like, "Oh, an osteopath." They're like, "What is that?"
Yeah.
They're like, "Oh, that's so cool." Also, what is osteopathy? So, yeah, why don't you give us a little bit of a rundown of what that is, what the core principles of osteo is,
Yeah.
or are.
Yeah, definitely. Yeah. So if you Google it, it'll kind of come up as like a holistic wellness practice, non-invasive manual therapy. But I find it really falls into the same category as massage or chiro in the sense that it's, again, it's a manual therapy. So the clinician's going to be working with their hands, applying different techniques. And the cool thing about osteo is that we learn a lot of different techniques. It's not just like muscular technique. It's not just joint manipulation. There's a lot of techniques we learn. But then, yeah, I guess when it comes to the woo side of things, we're falling into that territory of, well, I went to see somebody and they just held my head or they held my arm and it didn't really do anything. And I find that there's a place for those types of techniques. Like that would be craniosacral, where you're literally gently holding somebody's skull for 20 or 30 minutes. And that has its benefits. But for the core general public, I think we should be tackling, or clinicians should be tackling, what the client is coming for. So if they're coming for low back pain, yes, craniosacral can help with low back pain, but they might benefit more from a targeted low back pain treatment right on the spot there.
Right. Okay. And can you mentioned that there's a bunch of different techniques. Are they sort of categorized in a way, like more bone focused, more muscular focused, more massage focused, fascia focused? Like where Where do they fall?
Definitely, yeah. So there's talked about craniosacral a little bit. So that would be again the bones of the skull, along with the fascia and the dural tubes down the spine. Then we've got like a pressure point therapy where you are, as a clinician, you're going to be holding a sore spot. So whether that's the forearm or the low back, if there's kind of a knot, quote unquote, a knot, you'll be kind of putting pressure into that knot, putting pressure into that sore spot until the client finds relief. So you can hold it for 10 seconds, 30 seconds, whatever have you. And over that period of time, the pain will reduce. And then, yeah, we've got joint manipulation. So in our world, in our clinical world, there's different levels of joint manipulation. So massage therapists and osteos and physios can kind of do up to a certain grade, whereas the chiropractors, that's where you're going to see that high velocity, that big cracking motion come through.
Right.
Yeah.
Right. So you guys don't really do the quick manipulations. It's more about working with tissue to slowly ease it out of the position that it might be in, or to disrupt some sort of. You used the word knot.
Yeah.
But I know that's like, more of a colloquial or like a layman's term, something that people understand. But what is that actually what does that mean? Is it like a ball of muscular tissue that has gotten tense? Like what
Yeah.
would you define a knot as?
So for me, I always compare it to like the amount of tissue density. So if it's feeling really dense, that's either a strong muscle. So somebody who's working out a lot, they're going to have dense, thick tissue. But the same can be true for what we describe as a knot, where it's dense, it's a bit thicker, it might be ropey. So again, if you picture like a thick sailor's rope, that's what we're feeling in the body as we're doing the techniques.
Sort of like a bunching up of tissues, or like a
Yeah.
layer of tissues that hasn't cleared waste, or like what is the research, or what's the general consensus about what that might be?
So there's a couple of different things it could be. So obviously there's inflammation. So that's going to be like kind of stored blood that's not able to clear itself, or stored waste. So like lymphatic fluid. It could be adhesion. So adhesion is where two different groups of muscles. So like let's take your trap, and then your levitator scapula, they bind together through friction, and that causes that ropiness as well.
Right.
Yeah.
So that happens with like continued tension, muscular patterns, breathing patterns that might get those muscles to sort of bind together and feel like there's just no movement there.
Yeah, exactly.
Right.
Yeah, so specifically in like sports, you've got a runner who's they run, 40, 60, 80 kilometers a week. They're going to have a lot of friction on their thigh muscles. They're going to have a lot of friction on their hamstrings, their quads, their IT bands, and that's going to cause that adhesion over time.
Right. Okay. So it's interesting because it sounds like, adhesion means things are sticking together and not moving, despite the fact that these people are moving. But it's the repetitive motion that sort of gets them to adhere or stick
Yeah.
together in a way that.
Yeah.
And what does that come from? It just comes from the friction and the lack of blood flow or lymphatic flow. So like fluid flow in general that might prevent movement, I guess.
Yeah, so in a sense, yes, we've got kind of the fluid aspect of it. So that, yeah, the blood, the spinal fluid, the lymphatic fluid. So if that's not cleared, like the lymphatic fluid is literally waste in your body.
Yeah.
So if we're not able to clear that, that's going to cause a buildup of lymphatic fluid, and over time, yeah, cause that restriction, that pattern to form. Or yeah, it could be as simple as this person isn't stretching properly, or isn't moving properly. It's actually challenging sometimes when you're working with those high performance athletes, where they enter your office and they are so set in their patterns because they've been running for 20 years I'm not going to change your running pattern because it
Yeah.
works for you, but at the same time, it is causing these issues. It's causing the dysfunction. So
Right.
it's this balance of like how much are they willing to change in their habits versus what truly works for them as a runner or
It's
as an
true. And I think
athlete.
that also goes just for people who might not even be athletes, like people who are stuck at a desk job or people who are stuck in the same patterns over and over and over again, right? Like, even you think about a factory worker who picks up the same box in the
Definitely.
same way every single day or, whatever it might be. Like, we fall into these predictive patterns in our body
Yeah.
that, like, you don't have to be an athlete or you don't have to, have any particular behavior or group of habits that will cement your body. Like anyone can basically fall victim to lack of movement or some sort of knot or pattern that sticks their body in a position they can't get out of, right?
Definitely. And
Yeah.
it's actually a great kind of segue, I guess, to me, like personally, it can happen to literally everyone. Like last November, December, I had a newborn at the time and she was sick and I was rocking her in a very specific way. And I actually caused a bit of an ankle sprain through rocking her this very specific way. I was just rolling my ankle too much and I caused a sprain.
Yeah.
It's,
Yeah.
such a silly, something that shouldn't cause pain, but your body's just not used to it. You're
Yeah.
doing it too much. You're doing it too repetitively, and pain can come from anywhere.
And it can happen to anyone. It's so true. It's like
Yeah.
you see those videos of people who are like, I've been lifting weights for X amount of years. I've been deadlifting, 200 pounds, whatever it is. But, I went to go pick up a toy off the ground and threw out my back, right? And it's like,
Exactly.
you never know how or when it can happen. But just getting into a position that your body is not used to getting into or moving in a very specific way that the tissues are not prepared for can cause or it's like the straw that broke the camel's back, basically. It's like repetitive motions over
Yeah.
time, and then
Yeah. Over time, it develops something that shouldn't be a big deal. If you do it enough times, it's going to show up somehow. So yeah, that's kind of the overarching, I guess, how we apply techniques, and
yeah. Okay, can you tell me a little bit more about fascia, what it is and how it sort of connects all these systems? Because we did sort of talk about
yeah.
how knots can happen, and is fascia tied into that? Is it just a muscle thing? Like, what is happening?
Yeah, so the fascia's it really is tied into it. It's what connects our whole body together. I picture it as a fishing net or a web over our entire body, over all of our muscles, and it connects everything together. And essentially, over time, that friction that we're talking about, it's going to cause inflammation in the fascia, because that fascia again is what kind of keeps the muscles, keeps the blood, keeps everything internally. So if there's enough friction, it's going to cause problems on the fascia as well.
Sorry, so is it right underneath the layer of the skin before the muscle, or is it
Yeah,
really
like,
wraps in between?
it's more like it's like a sheath of tissue right over the muscle. So
Okay.
do you eat meat?
I do, yeah.
Okay, so if you like go to the store and you buy a steak or a chicken breast, like it's going to be that kind of
That white
that
sort of
yeah
film
that
almost.
film, that kind of translucent film over the meat.
Right.
I know some people, vegetarians don't. I don't
Oh,
want to
well.
gross people out, but yeah, it's like this sheath that covers all the muscle and
Right.
yeah.
It helps it to move. It contracts. Like, what is the purpose of the fascia? How does it tie into everything else, literally?
Yeah, so it allows the muscles to glide over each other. It allows the muscles to move properly, and to not expand too much. Like I always take the quadricep as a good example. Your
So the
thigh
thigh
muscle, the IT band is right adjacent to the thigh muscle, and essentially, if you're going to be running or doing a repetitive motion, that thigh is going to get inflamed or full of blood, and the fascia is kind of what keeps that thigh muscle in check.
From
from
moving too far, getting too
moving
big,
too
getting too pumped
far.
up? Like, what is
Yeah,
the
kind of all of it. It's like it keeps the blood kind of internally. It keeps the muscle internal,
right?
so that it doesn't get too inflamed.
So is it basically? Can you think about it as like almost a highway for your
Yeah,
fluid and blood and
yeah. In a sense,
in a
again,
sense,
like a highway. I think the way I'm visualizing it would be more internal. So
right?
like the highway would be like our veins.
Veins, yeah.
Whereas yeah, it's like a web that
Yeah, it's kind of we're getting lost in the metaphors a bit, but like it basically guides movement and helps to
yeah.
create separation between muscles.
Mm-hmm.
And when does problem happen with the fascia, and how does that relate to the cases that you deal with?
Yeah, so the problems with fascia would happen when, let's say, there's an adhesion, and it kind of bunches the fascia up. So the fascia, again, if you visualize it as this sheath over the whole body, if it gets pulled too much, you're going to see that increase in friction. You're going to see other muscles getting pulled towards that bunching of tissue. So that will cause restriction in movement. That will cause restriction in overall blood flow or lymphatic drainage. Again, using your shoulder, if you were to visualize like, well, I'm adhesed here, my fascia is getting pulled up my neck, and my shoulder is going to slowly kind of rise up near my ear. So that's going to cause neck pain, all sorts of issues here, maybe some nerve damage, not damage, but
Compression.
compression. And the patient's going to come in and say, oh, well, why? Like, I'm stuck like this. Like, I can't move. I can't free my arm. I can't raise my arm up. And that's where we come in to release the tissue, allow the fascia to glide, allow the muscles to glide,
Right.
and relax. Yeah.
Right. Okay. And then would you consider that like a dead end? Like, okay, the tissue is released. What now? What are the next steps after that? What do people need to focus
Yeah,
on?
yeah, good question. Because that's something that within our clinical practice, people want the immediate fix, but don't want to perhaps continue that care.
Right.
So that what we would call like a wellness visit or a follow-up appointment where you come in. It's just a maintenance visit where you just make sure you're still moving, make sure there's no bunching happening, make sure that that repetitive motion that you're continuing to do because that's your job or your lifestyle,
Yes.
make sure it's not impeding your movement again.
Right.
And then we also offer home care. So that would be stretching or exercise that you can do at home that would benefit you, prevent further injury, make sure that you're strong enough to do whatever you're doing. So take that factory worker lifting that bag up or lifting the parcel up. Well, that person has to get stronger to prevent that from happening again.
Right.
So,
Because if the muscles that you should be using aren't strong enough to accomplish that task, then there might be some other group of muscles or tissues that try to take on that job and then become restricted or change in shape over time. Is that a possible?
yeah, definitely. We would call that a compensation.
Right.
So
Yeah.
in the case of the arm here, your shoulder's creeping up. You're going to probably see some compensation in the bicep or the forearm.
Interesting.
Yeah,
Okay, so people with like tennis elbow
yeah,
or
exactly.
issues in the
Yeah, tennis
connective
elbow,
tissue in the
golf elbow. Like you may have a problem in your elbow, but the other areas of your body will start taking over the load.
yeah.
Whether that's purely for strength to compensate for strength or to compensate for pain, which we would call guarding. So that's where somebody's restricting their motion, not on purpose, but subconsciously restricting their motion to prevent that pain from happening.
Right, because that can cause excess inflammation and then it's just a terrible feedback loop, right?
Yeah, exactly.
So, well, it sounds like you deal with a lot of cases like that. Like,
Yeah.
what would you say is a very common complaint that you get when people come in? I mean, it's all low back pain, back pain,
Yeah, low back pain
all day,
is
every day, but
definitely kind of, I'd say, a bread and butter. It's going to be everywhere.
Yeah.
Unfortunately, that's our lifestyle. I think within our culture is office work, lots of sitting, lots of repetitive typing or meeting taking. And it sounds so silly, but to be looking at the same camera for 45 minutes every day will cause problems.
Yeah. Yeah.
So low back pain, neck pain, we take pretty much any case that's in pain, somebody who needs help. That's really what we want to focus on, and what we do focus on as a clinic is making sure that people are getting the help they need so they can return to their lifestyle, return to their kind of why, I guess, of
Yeah.
why they want to live their life, what their passions are, whether that's complex like skydiving or doing marathons, or whether that's lifting your kid up to put the star on the Christmas tree.
Yeah.
You know?
Yeah. Yeah.
The why of the client is really important to us. So
Right.
yeah.
Yeah, and I think it sort of goes back to what we talked to when we initially started chatting about what we were going to talk about today, and that determining that why and sort of figuring out how osteopathy specifically fits into the web of practitioners that people have at their disposal. Like, I'm curious about, I'm sure you guys get a lot of referrals, and it's mostly like, and that's how things build over time. But when people are coming to you, like, what do you want people to think, or when do you want people to think osteo?
Yeah.
You know?
It's a tough one to answer because I find you spoke about referrals. Typically, the referral pattern, if you were to go to your doctor, would be they would recommend physio, they would recommend chiropractor, and they'd probably recommend some sort of muscle relaxant. Again, I'm not a doctor here. I can't talk about prescriptions, but I find osteopathy does a really good job of combining those worlds: physiotherapy, chiropractor, and massage. We kind of touch on, again, the muscles through that pressure point therapy. We do joint manipulation, not as advanced as a chiropractor, but we still do it in a sense. And then exercise, we don't call it prescription because that's a very it's a protected word through physiotherapy. But recommendations of how to get better, how to prevent further injury.
How to disrupt the pattern that you're stuck in,
Yeah,
basically.
exactly.
So I guess with chiro, it's more spine focused and focusing on the health of the spine, and then a lot of that. They do a lot of sports therapy as well, and will show that there's compression coming from this disc, and that's radiating down your arm or down your leg and whatnot, and nervous system stuff. Physios are very reactive, but also proactive, and it's more about that sort of like exercise prescription, hopefully progression should be that way. Personal trainers and strength and conditioning coaches focus on strengthening you, should be about creating new patterns and strengthening old ones if they are helpful to you. And osteos sort of try to pull it all together. Why are you guys different from massage therapists?
Yeah. Good question. Again, our what we call a scope of practice is what our techniques are. Very similar. So we can apply all the same techniques. However, it's really comes down to the outlook of what we're trying to quote unquote accomplish with the body. So massage therapists are generally focused on blood flow and like the musculoskeletal system, so specifically the muscles. So you go to a massage therapy appointment, whether it's for relaxation or for a therapeutic purpose, they're not going to be doing very much motion-based practice. So like a joint mobilization, something like what we call muscle energy technique, which is an active passive stretch. So I apply an active stretch to you, to the affected body part, and then wait a couple seconds and then go into more of a passive. So it's-
Okay, and what does that mean?
yeah,
Active versus passive.
active versus passive. So
And you're
active would
putting-
be,
Go ahead.
yeah, sorry. Active would be where I'm applying a stretch to your body and you're resisting.
Okay.
There's a force that you as the client are providing to me, and I'm applying a corresponding force. And then passive would be where you, the client, relax into the stretch and deepen the stretch.
Right. Okay. So it basically opens up new space that you haven't felt before, which I have done before,
Nice.
and feels so good. And
Yeah.
it's like it's a wild sensation because
Yeah.
it's like suddenly you can't move into this area. You do all that like
That tension.
the tension
Yeah.
pushing against each other, and then suddenly huge amount of space just opens up.
Yeah, it's amazing.
And I think, there's people have different takes on that.
Yeah.
And some people would say, oh, it's gimmicky and it's in the moment. And, that range of motion isn't going to stay because your nervous system doesn't want you to go there in the first place.
Yeah.
Why are you moving into that space now? Because often the nervous system will tighten up and restrict an area if it feels like it's unsafe to move there. Compared to, the other side of the pile where it's like, no, we are creating new space. I'm assuming you fall more on the latter side of it, but how do you think that fits in with other types of stretching where some people might argue that you're forcing a muscle into a position that it shouldn't be going, or you're overstretching, or potentially compromising soft tissues like connective tissues, like ligaments, tendons, stuff like that? Like, where would you fall?
Yeah, so that's where the relationship between the client and the clinician is so important. There has to be really good communication, and that's something I do when I'm working with this particular technique. Is I make sure that I communicate with the client. Hey, we're going to do this for 5 seconds. You're going to push into my hand, then we're going to relax, and just tell me if it bothers you, if it kind of creates more pain. Yeah, I think opening space is okay. It's very, oddly enough, it's very similar to like a chiropractic adjustment where you're doing a quite a dramatic, drastic change to the body.
Yeah.
And expecting it to just stay. So that's where, as personally as a clinician, I combine that technique with other techniques. So I'll do like myofascial release to release the area first before we get into a deeper stretch. So if there is already more space through releasing the muscles, through releasing the fascia, then we're going to be able to access the space through a stretch.
Right. Okay. And sort of cement the nervous system or download that space in the brain. So basically tell your brain, hey, we have access to this now and we're going to keep it, kind of thing.
We're okay.
Yeah.
And that's kind of where, again, personally as a clinician, I find my mentality is always like kind of reduce the pain. So get rid of the pain, whatever you're doing, whether that's an exercise, a repeated home work environment, get rid of that thing that is causing you pain. So that way we can make space and turn off those brain signals and say, hey, we're okay, we're safe here. We can access the space, we can do the stretches. And then after you're feeling better, we would reintroduce some strengthening exercises to kind of keep those gains.
Yeah, yeah, because there is so much fear around injury where people sort of be like, oh, I'm injured now, I can't move, like my body needs to heal. And that can often cement that person deeper into the pattern of pain because then they're not moving and not creating a new position for their brain and their body to get into. Where do you sort of, I'm sure this is very subjective, dependent on the client, the patient, but when do you decide when to push forward and when do you decide to push back?
As in with the client?
Yeah. It's sort of like when do you think like, okay, they're in pain, we should back off here.
Right.
Or they're in a little bit of pain, but there's an opportunity here to do X, Y, Z.
Yeah.
How do you decide when that is?
Yeah. So working with the clients, that's again, I think establishing that communication, that trust is really important. But saying, okay, like this is your lifestyle. You're somebody who goes to the gym 5 days a week. Maybe we need to bring it down to 3, just to allow your body some rest time. And if there's anything that you're doing at the gym, whether that's a deep squat or a deadlift, whatever it is, we need to just pause that for a few weeks. That's typically my approach. But then, yeah, I get clients all the time who are like, "Well, I'm just gonna do my thing. I'm gonna keep doing it." And typically, what I've seen is those clients do take longer to get better. It's not always the case. Of course, there's going to be people who are resilient and continue to push through, and that's fantastic. But my approach is always, yeah, like whatever specifically, like it's not your whole routine. Like you don't need to stop walking and running and jogging, and it's whatever is actually causing you pain in that moment.
Yeah, which
So
also requires a lot of paying attention to
yeah,
what's happening, and I think that can be difficult when, especially if you're doing so many different things. I've walked the injury path before, and it was like
yeah,
there's been times where it was like it feels like everything is setting me off right now, and I have no idea what it is,
yeah.
and it took stopping everything for a little bit. And I'm still kind of undecided about that approach.
Yeah.
Like because now my approach is not to stop; it's to just find what works. There's like it's like the good life saying. It's like don't let what you can't do stop you from doing what you can do.
Okay.
The
Yeah.
thing is not to stop exercise or to stop doing the things that feel good, which can be difficult and scary when you don't know what is triggering your pain and what is triggering your symptoms.
Definitely.
And I think that's when it calls for rest and time to just sort of sit in your body and figure out, okay, like I must be really inflamed right now.
Yeah.
My nervous system is freaking out. And sort of figuring out, paying a lot of attention to what seems to set you off the most and what seems to be manageable. And because there's so many different ways that pain responses can come. So it's interesting to hear different takes like that because I think, the industry is still very undecided about how to approach these things. And it's so individual.
Yeah. No, exactly. And that, again, I think that's where, as a client coming into a clinic, whether it's my clinic or another one, it's important to understand, like, we may ask you to stop, we may ask you to pause, but it's not forever. Our goal is to get you back to what you want to do, right? Like, it's not, hey, you're never allowed to run again. You're never allowed to, surf or whatever it is.
Yeah,
Like,
yeah,
our goal is to get you back there.
yeah.
And making that space for yourself as a client, like, hey, I'm allowed to rest, and then I'm allowed to do it. Okay, I'm going to rest this week, and then next week I'm going to do light yoga, and then the week after that I'm going to do some mild squats, maybe body weight instead of 100 pounds. So it's that slow reintroduction to exercise. Sometimes the pause is needed, and sometimes, yeah, I think, hey, weekend warrior, go for it.
Yeah,
Like
yeah.
whatever you're feeling, I think is what you should do.
Yeah.
But yeah, it is really undecided. I think as an industry,
It's difficult.
we're all over the place with everything. So
Yeah. And I think also just defining what your goal is, what you want out of receiving treatment, what you want out of your training, and then going back and seeing whether your training is reflective of those goals, and whether your lifestyle is reflective of those goals, and what kind of changes you're actually willing to make. Are you willing to show up to personal training every week? Are you willing to invest in osteopathy, physio, chiro, whatever it is? Are you willing to do all of your exercises and all of your techniques? Are you willing to, are you looking for a quick fix? Like, do you want to just go get surgery? Do you want to just go to a doctor and find their opinion on it? And, there's so many different avenues you could go. But I think, number one, when you're going to see someone, the question you need to ask yourself is, what are you willing to get out of this? Or what are you hoping to get out of this? And what are you willing to do to get it.
Yeah. Yeah, and that touches on the client's why. Like, why are you, like, everybody wants to get out of pain, right? Pain sucks.
Yeah.
But when it comes to, again, like, what are you doing? What are your goals? Are you that surfer that wants to take a trip twice a year to go to Hawaii? Are you somebody who are you elderly and really want to give your grandchildren the opportunity to raise them up and put that star on the tree? Like,
Yeah. Yeah.
whatever your why is, it's beyond pain, I think, and that's where the client has to connect with that. The client has to understand that, like, we can help you, we can get you out of pain, but are you going to be able to return to that activity that you want to do, without continuing that stretching program, that exercise program, without, beyond osteopathy or physio or massage, like, go to a personal trainer, get stronger, build that muscle so that you can continue to do these things. Yeah.
Yeah. I think it's the most important question that anyone could ask before they do anything. But I'm curious about the sort of unconventional ways that you guys provide relief for people. Namely, like we've talked about briefly, like viscera stuff
Yeah.
and, gut stuff, organs, stress, grief, emotional stuff, and about how, it's kind of complicated with osteo specifically because people will be like, oh, I don't really have a very specific complaint. I just want to feel better. And it's like, we all sort of know what that means. Like, yeah, you want to feel energized. You want to feel limber. You want to feel quick. You don't want to feel slow. You don't want to have brain fog. You want to have, good digestion. And, we all want to feel perfect all the time. But what kind of services have you seen work for people in a way that's sort of unconventional? And then I want you to sort of go into transformations, and we can talk about that after.
Transformation.
Yeah.
I mean, so visceral, like the practice of visceral as a technique, quote unquote, it's broad. Visceral, it's like it's your organs. Essentially, we're manipulating the fascia that connects your organs internally, and that could show up as bloating, cramping. All sorts of different conditions that can form in the gut. But yeah, essentially we're moving, whether that's your liver, your kidneys, all the different organs. We're creating space for them to do their job. Again, kidney, liver, like we want better flow of the fluid. We want better drainage, right? So if something is restricting the flow, the organs, you're going to have problems. Whether, again, like specifically in the kidneys, right? You've got kidney stones that form, and that's from buildup of like, I want to say sediment, but different minerals that form into a stone in your body, a sharp object. And if there's not that good flow, and bad hydration, you're going to have problems with your kidneys. Looking at again, more of that gut health, that bloating aspect. So it's interesting because it does feel unconventional. Like, why should somebody poke on my stomach? Why would that make me feel better? But yeah, it's the same concept, right? It is making more space, creating more space, reducing that signal to your brain that there is a problem here, to allow healing.
Yeah.
Then we've got the cranial sacral therapy, which again feels very woo-woo. The manipulation of the bones of the skull and the manipulation of the dural tubes, the tube that runs down the back of your spine.
Through the spinal cord, or behind it?
Yeah,
or?
like it's from top of skull down to your tailbone. It's this pathway for spinal fluid.
Yeah.
And the same premise applies here, is that if there's restriction in motion, if there's restriction in the tissue, you're going to see, whether that's a bunching or an adhesion form, that pulls the dural tube, pulls the spinal column downwards, creates tension on your tailbone, creates tension on the top of your skull. That can relate to like into headaches, migraines, could cause muscle pain. So while it feels really woo to have somebody hold your skull for 30 minutes and say that's the treatment,
Yeah.
good luck with your back pain, there is a purpose to it, even though the purpose may sometimes feel mundane.
Yeah.
It may feel irrelevant to like my really 8 out of 10 low back pain that's just throbbing all day long. There is a purpose.
Yeah.
And it does really come down to anatomy, which is it's strange, but it works. Clients have liked it. Like clients pay lots of money and go see these people all the
Yeah.
time. So
Yeah.
there is space for it. Yeah.
I guess it's just like what people are looking for, what they're expecting from their treatment again, and what they're willing to try. Because, truth is sometimes stranger than
Yeah.
emotion. And
Oh, exactly. And take my personal experience, or take, countless clients. Like I tried massage, tried these different therapies, and went to osteopathy. It was my last ditch random effort. My mom said, "Hey, go to an osteopath," and here we are.
Yeah.
Like it works. And that's something that I get a lot of in session in the office, is that feedback of like, well, I've tried everything. I just can't get rid of this pain. I can't get rid of it. It's been 8 months, 10 months, 3 years. And osteopathy seems to have this magic to it, this woo woo magic feeling of like, this just fixes things. But it's just really, it breaks it down into anatomy, understanding how the body works, and understanding how to apply our principles, or what guides our practice, which is really, it's about function and kind of how the body relates to that function.
yeah.
Kind of an overarching premise that we put into every treatment.
Yeah, like a system of systems.
Yeah.
And everything sort of works together to promote or prevent flow of
Yeah.
fluids and
Fluids,
waste
waste,
or
inflammation, all that.
inflammation.
And
Yeah.
it's again, I think as a client, you're like, well, what is inflammation? What does this mean? And it's going back to that like magic feeling. I'm sure it happens in other professions, in maybe physio, chiro, right? Like you're going to be like, oh, this fixed me. You're magic. And
Yeah,
it's like,
yeah.
well, it is anatomy. When you break
Yeah.
it down into like, somebody studied for a long time and they understand the body. Like I couldn't do accounting to save my life,
Yeah, yeah.
but I'm good at what I do.
yeah, yeah. And it's like sometimes you try something and it works, and
Yeah.
you're like, well, okay, that's great.
Yeah, exactly.
That's exactly what was going to happen. But it can't hurt to try, and it's one of those things that when you know that there is a disruption somewhere and you try to free it up, there's going to be some sort of relief. Like that to me is a very A to B easy transition. It's not like, oh, this cured my disease of some sort. It's just this
Exactly.
symptom cleared up. Sometimes it can be that specific because, I disrupted the tension, the restriction, whatever it is. And maybe that's the thing that pushes you further on towards the path of healing. Yeah.
Yeah.
I want you to talk a little bit about we talked about plantar fasciitis a little bit, and it sounds like you've worked with a lot of people with plantar fasciitis. It's sort of like a bit of your niche in a way. I'm not
sense,
sure if that's the right word to use for you, but you seem to have it down pat pretty well.
Yeah, it's pretty funny. It's something I just stumbled onto. We all have things that we're good at, and it's been something over the last, I'm coming up on 10 years of practice, and over the last 10 years, I've honed in on how to treat plantar fasciitis, and I can kind of guide a client through, 6 to 8 sessions, and some very specific home care tips. Magically, A frozen water bottle. Just go to the dollar store, go to your local. I'm giving you some trade tips here.
There you go.
Go to your local gas station, throw a water bottle in the freezer, and then roll on it, and that really, really, really helps
The foot.
with the foot. Yeah, it's better than a tennis ball, lacrosse ball. For some reason, with plantar fasciitis specifically, that's kind of my go-to. Which again sounds silly. It's like, well, why can't I use all these fancy tools that I ordered on Amazon? And
Yeah,
it's
yeah,
like,
yeah.
no, just a water bottle, frozen, relaxes, releases the inflammation, cools the tissue down. And yeah, footwear as well is a huge aspect with
Arch support.
plantar. Yeah, arch
Yeah.
support, making sure that you've got that support in your ankle and your foot, which is it's so funny. I had a client a few years ago. We were working through plantar fasciitis actually, and they were like, I'm going to this crazy trek. I'm going to go camping and hiking for like 4 days. And I was like, well, you're literally dealing with a foot problem.
Yeah.
Like, you can't do that. And they did. And it was the footwear that really got them through it.
Yeah.
And they got back. So through our treatment and through the change in footwear, they were pain-free.
Yeah.
Even with a huge hike. It's like,
There you go.
change a couple patterns.
Yeah,
and
so true. Just give your brain a new input, a new strategy to move in a different way, and it's money. I want to hear more about, like, would you consider that like one of your biggest success stories? Do you have another one that always sticks with you? Like, what do you have any crazy ones, like things that are very unexpected, and suddenly they were like, oh my God, I'm healed? Sorry to put you on the spot.
Yeah, no, that's okay. Plantar fasciitis is a like, yeah, I think over the last 3 years, like I've worked with, I can't even count how many people, but it's like,
Yeah.
like not guaranteed, because I don't like to promise things.
Yeah,
but
yeah.
It's like 6 to 8 treatments, and while 6 to 8 treatments it does cost a lot. It's a good chunk of money. What is, like, going back to that why, what's going to is the money going to stop you from getting your foot back and being able to walk or being able to hike? What's the prevention? What's stopping you from continuing to go on?
Yeah, that's true.
So I mean, if I say, hey, you're going to be pain free in 8 sessions, it'll cost you, however much, but fantastic.
Yeah.
8 sessions, sign me up, right?
Yeah.
Like,
Yeah. Especially with plantar fasciitis, like people always talk about how painful it is,
Yeah.
and it's like debilitating.
Yeah.
Changes your life.
it really does.
Yeah.
Like, we use our feet for everything,
Yeah.
right? All day long. So, but yeah, plantar fasciitis would be a big one for me. I also, I tend to see a lot of sciatic nerve issues. So the sciatic nerve goes down the back of your leg, and that can cause low back pain, buttock pain, radiating nerve pain, like numbness, tingling. It's really, really awful to experience it. But that's another one. Again, it's not a guarantee of how many sessions, but it's something that, like, you can really see a benefit. You can really see that improvement of lifestyle.
Yeah.
With that. Yeah.
Yeah, you kind of feel like you've gotten it down to a science now.
In a sense, hopefully.
Yeah.
Yeah.
Well, yeah. I mean, like trial and error, and
That's it. Stretch this muscle that way. Apply these techniques, and we're constantly learning. We're constantly trying to figure out the patterns of
So
the
true.
body. So yeah, while it is anatomy and it is something we've studied a lot, there's always going to be those odd cases where you're like, okay, I think you should go see this person. This person might be a better fit for you, because that's not my wheelhouse, not my expertise. That's where that clinic feel, right? When you go to a clinic that has multiple services, multiple practitioners, you can get that care of like, well, okay, your clinician that you signed up with might not have the exact answer, but they know of somebody else who does.
yeah, it's so true, and it's the benefit of having a big network of people within your clinic, and then outside of it, and knowing when and where to refer out, which I think is like a big ambition of everyone who is in, a health, wellness, fitness space. It's like we want to create a web of people that can help, and you don't just need to go to your doctor and then get no answers because, maybe that's not what they do. They can help you and they can refer out and give you the best information that they can. But which is not to say that you should make decisions without your doctor, but it's just to say that there are so many answers out there, and there's people who want to help, and there's hope, and you don't need to just get an injection, or your only option isn't surgery, and or to just live through it, or yeah, I think that there's options. I want to finish with do you have any actionable items for us that are how to take care of your fascia? What do you want people to do at home? Do you want them to massage themselves, keep things moving, hydration? What are your quick tips for making sure that things stay limber?
Quick tips, I think, is just a general light stretch routine. I think when people hear stretching, they get overwhelmed. They spend so much time in the gym or with their exercise program strengthening their body. So it's well, why would I add another 10 minutes to my routine? Stretch is really important. It's what allows our body to access that space and continue to build muscle. Hydration is really important. Not only just simple water, but also making sure that you have your electrolytes are balanced, your magnesium and potassium. We're kind of stepping into a dietary conversation, or more of
But
necessary to have. But I always if people are having cramping in their legs, or that big the fascial pull of that restriction feeling, I'll always recommend to go to the pharmacy, discuss with your pharmacist about magnesium. There's creams and pills. Creams are really good for that restless leg feeling at the end of the night. Pills are more of a generalized daily natural muscle relaxant, I would say. I think water intake and balancing of your minerals and electrolytes.
Yeah. And, I think that's a big concern in the nutrition space as well, and just agricultural space. And our soil is pretty depleted of minerals. And if you're on that wavelength, that, a lot of vegetables that we have today are depleted from minerals and vitamins that used to be in higher quantities in those vegetables. And this isn't to say that you need to go out and get a bunch of supplements, but just the importance of eating and your hydration and having a whole food diet that ensures you're getting your minerals in. And, if you can't get them in, then to use some sort of electrolyte or supplement to help you get along. Because it's not just about the muscle and the fascia and the hydration. It's also about brain function and your body's ability to use the food that you're eating. But yeah. Okay, good. So stay hydrated. Electrolytes.
I know that's
keep it moving.
It feels silly because
But
you
so true.
you get those classic memes online of oh, I've got this pain. Oh, you should drink more water. It's actually you should drink more water.
Yeah.
I have clients, sometimes they tell me they're getting maybe a liter of water a day, and it's you need to be drinking 3 or 4 liters a day. So, and I
especially if you're working out and
exactly
exercising and on your feet all day and stuff like that. Yeah. Makes a big difference.
It really does.
Yeah. Okay, well, where can people go to find you? And give me a little rundown of your clinic and how many people you have with you guys, and
so online we're glebewellness.com. That's our website. We're at 901 Bank Street. So if those familiar with the Glebe area, that's going to be right above the running room or right across from Kettleman Bagels.
There you go.
So you can grab a bagel, come for a treatment. And then in terms of what we focus on, really focus on that establishing what your issue is. So that's going to be a general intake conversation, maybe 10 minutes of an initial appointment, followed by a treatment to reduce that tension, reduce all the things we've talked about today. And then followed with, after that, maybe a 5-minute conversation on next steps, whether that's more treatment, home exercises, water intake increase. So that's what we do with that initial appointment. So if you're coming to us for help, that's what to expect. Nice little conversation about what's happening with you, how to get better, and then follow up kind of tips. And then in terms of our team right now, we've got osteopaths, our kind of staple here at Glebe Osteopathy and Wellness. And then we've got RMTs, massage therapists. So we've got 3 massage therapists right now, and then a team of how many osteopaths? 5 osteopaths. So nice rounded team. We are always looking to expand. So if there's any clinicians listening to this right now, glebewellness.com. You can apply, whether that's a chiropractor, massage therapist. Definitely looking to see some resumes.
Awesome. Okay. Well, great to know. Thank you for listening, guys, and stay tuned for our next one. And thank you, Liam, for
thanks for having me.
Yeah.